360-degree access to skull base. This is just to enumerate, just 10 minutes, just to enumerate the different skull bases approaches available in. So this is a skull base. It is divided into an anterior skull base, the middle skull base, and the posterior skull base. This is a table taken from a review article showing the different approaches to get a 360-degree access to the skull base. Anterior skull base, as you all know, this is the intracranial aspect, and this many ENT surgeons may be familiar with this view. So for the anterior skull base, we have the classical craniofacial resection, mainly bifrontal craniotomy, which is done by the neurosurgeon, and the transfacial approaches can be lateral rhinotomy, Weber-Ferguson, or simple ethmoidectomy, or even mid-facial declawing. Subcranial approach is a limited approach which can be done in selected cases, and then we all know we have endoscopic approaches. The one in reds, we are trying to show it, and you may be able to do it hands-on. So this is the middle cranial base again. It is divided into central and two lateral compartments. For the central compartment, we have transeptal sphenoidal approach, transethmoidal sphenoidal approach, again lateral rhinotomy, midfacial deglowing, transpalatal, transoral, and then mandibulotomy. Mandibulotomy can be used for many ways. And then we have the maxillary swing or the facial translocation. And in the lateral compartment, we have the transtemporal, infratemporal, transfacial, and intracranial approaches. And in the transtemporal, it can be transcochlear, translabyrinthine, petrosigmoid, retrolabyrinthine, or combined approaches of this. Infratemporal approaches of fish, you know, translateral transparotid. We will be initially demonstrating a parotidectomy, lateral facial, and then subtemporal, infratemporal approaches. Transfacial, again facial translocation to the lateral skull base. And posterior skull base is classical neurosurgical approaches like retrosigmoid or suboccipital, far lateral, and petrooccipital, transsigmoid approaches. This is just to enumerate. Now we'll be starting. So you will be divided into 5 batches. We have 5 bodies and 1 demonstration, and each body you will be divided on either side. For parotidectomy, for mandibulotomy and facial translocation, each group may be able to do it, but for bicoronal flap and subcranial, you will have to do it together. And endoscopic anterior skull base and temporal bone dissection will be just demonstration. So initially we will divide you into batches, and then Dr. Iyer will be showing you a parotidectomy.